So as I mentioned at the start, one of the other proposals within the social care white paper was around small repair services. So I'm really pleased that we've got Sarah Parker from Borough Council of Kings Lynn and West Norfolk here this afternoon, who were one of the winners of the National Healthy Housing Awards just before Christmas. They won the Handyperson Services Award. And Sarah's going to talk us through what their service does over in Norfolk. So over to you, Sarah.
Hello, everyone. So this is our service. So we were very proud to submit and showcase what we do here in West Norfolk. Credit to the team who work obviously really hard to provide this really great service to our residents. And yes, we were absolutely overjoyed. So thank you very much for recognising us. So just to run through, I'll show you how it started, how we use the funding, stats, who it helps, job types, delivery, how we've innovated our service from as it keeps developing, and we'll continue to innovate. Show you a few testimonials, and then there's a slide where if you have any questions, feel free to put them through to us. I'm a bit time bound today, so yes, feel free to ask anything and we'll respond. So the Handyperson Prevention Service originated back in 2006, very much a minor repair service. So it was recognised that people struggled sometimes to get certain things done, for furniture moving, plumbing, putting up curtain poles, all those kind of things that people associate with a handy person, and struggled to engage with professional tradespeople. So it was sort of supported within the council that there was a service that needed to be delivered. That went on, and then in 2017, the Handyperson service was reviewed. We'd obviously developed and worked with social services who'd kind of asked us if we could help because they were having restrictions on their own budgets to provide the low-level measures. And therefore, what could we do to help assist them? Because obviously the need was still there. So we tailored our service to kind of move away from those minor repairs a little bit, although still delivering them, but making it more of a prevention focused service. So anything that would help people remain safe within their home, align it with the minor adaptation without delay concept, and work alongside our DFGs and major adaptation service, which obviously sometimes goes hand in hand. It can help you eliminate the need for large adaptations by putting low level measures in, or it can help in the meantime whilst waiting for anything much bigger. So how we fund it, our Handyperson Prevention Service forms part of our discretionary assistance that we have on our housing assistance policy. So we get obviously 1.7 million from the Better Care Fund. We top that up here to 2.1, which is spent mostly on our DFGs. But we allocate 150 to 200k to our prevention cost code, which obviously helps fund our Handyperson service. So we have a suite of discretionary measures available to us, and we put this as a prevention grant. And what we say with our service is that we can provide low-level measures up to £300 generally. We also have a safe and secure grant, which we use with the same parameters. And we can combine those two grants if necessary. So if there is something that was obviously going to be more costly, then we can pull from those two grants to make that possible for the client. Obviously no OT requirement within the Handyperson service, and other grant assistance are available on a case-by-case basis. So obviously we have our emergency grants, and we have an under 1,000 grants. So if anything goes beyond that, then we are able to help with that as well. So just to give you some stats on where we are. So first year, after the review, we spent just over 127k. This has now grown. Obviously, we've reached over 190k 2021. So it's a big increase. So you can see how it's grown, and we've helped publicise it. We've had pre-pandemic, we had marketing teams who would go out to cafes or sports venues, attend events and supermarkets to help promote the service. And our total spend so far has been just over 600,000. Predicted spend for last year into this year is 200,000, and clients have helped has obviously exceeded 2,000. Jobs completed, obviously, because clients can have multiple jobs, is just over 2,300. And we also do works with the QEH. QEH is our local hospital, the Queen Elizabeth Hospital, and we help provide a service with them. We work very collaboratively with them to help with their prevention service and getting people home from hospital, which I will talk about a bit later. Referrals, just over 130, we have made to other services, which is 6% of our client reach. Now, sometimes when we have referrals come into our Handyperson service, they've already been touched by the council, other departments. So it might seem on the lower side compared to others, but it's normally because we have all we're in a chain link effect. But we have managed to refer on to other services once we've visited our clients. Referrals coming into the Handyperson services a week averages between about 25 to 30 a week, although after Christmas we did have a record 40 coming in, whether that was just because people had, because of the Christmas break, has saved it up. But again, it is growing. So it's a free funded service. So we say that our service is available to West Norfolk residents, which is great. It's no financial assessment, so no grant filling, no invoicing and paper trail. So it's a fairly streamlined service, which enables us to deliver that quickly and with limiting staff resource. West Norfolk residents, as I've said, with a disability or health condition. So it doesn't need a formal diagnosis, but it's anyone who is struggling with their health in some way. We provide low-level measures around the home. And as many of you know, it's to assist making the day-to-day living easier and safer, reducing their likelihoods of falls, their need for assisted care, which is obviously important, and maintaining their independence. So that's a big thing that we come out a lot. People don't want to feel dependent on others, and where we can help with that obviously makes them feel much better, so better for their mental health. Referral service, the Handyperson service helps identify opportunities for additional services. As many of us do, we can, just by attending via this service, we can identify poor living conditions which might not have been brought to the forefront, hoarding, financial issues, where we can then refer on to our benefits department, and or any other mental health issues, loneliness, and also dementia obviously comes up when we visit. And again, that might not have been apparent through the referral, but by visiting that client, we're able to identify that as well. So the service includes, we offer a home safety assessment. So if the need isn't clear on the referral, we have our trained handyperson will go out and he will go around the property with the client and witness how they're moving around their property on a day-to-day basis, so he can identify any needs. And then obviously I won't go through them all, but these are our low-level preventions that we offer to people. It's not exhaustive, obviously, but these are just some of the ones that we do. And really, our service, we believe in it providing help to the vulnerable residents. And obviously that helps their family, friends who obviously worry about them, and that brings reassurance. And, where finance is limited for some people, that helps. So our current structure, in-house, we have 4 associates who manage the service. We have our technical manager, who's a trusted assessor, level 4. We have our admin manager and admin. Now these both oversee our DFGs and our Handyperson service. So very well versed in what's going on there. And our admin is very good at diagnosing over the phone and getting people to, when they refuse this, oh no, I don't need, I'll explain that, how that's come about later on, actually, bear with me. Yes, and our Handyperson, as I've said, who's a trusted assessor and also dementia friendly trained. And obviously years of mentoring from our OTs. We've had both working within and outsourced and social services. We also have a team of external contractors. We have a framework of contractors for our DFGs, and we also use them for our Handyperson service. Initially, our Handyperson service had 3 Handypersons, but now we're down to 1. So we feel that these are a good source and resource for us to be able to deliver our service. And it works really well because the grant pot helps to fund the contractor use. We've got an increased skill set. Obviously, more diverse, increased capability during high demand. So if we do get a lot of referrals in, like we did just after Christmas, we're able to still deliver in a timely fashion to those residents. And And also it helps us mentor and guide our contractors in delivering a great service by having those contractors on board. With our framework, we have introduced, we use SurveyMonkey, so we've introduced a survey review that we do on each job, and it helps us identify any issues maybe when they've done an adaptation, and it helps us mentor and grow them into understanding better what we expect and work, and it works really well, and we deliver that to them and show them the performance from SurveyMonkey, and they love it. They find that really beneficial. It helps them see how they're performing and what they're doing and what they can do better. So that works really well. Our future structure, we are currently recruiting for another half an admin post to help with the service because of its growth. And because of the capital pot spend that we make on the service, we are going to be doing, as we do for our DFGs, having a formal contract with the contractors where we will, where it's a bit ad hoc at the moment, we're going to have a designated 2 contractors to carry out the service who will, need to be available for any emergency call outs. Obviously, our low-level prevention works to help us deliver that service. Questionnaires are going to go forward again on SurveyMonkey, very similar, so we can relay that back to them. And yes, again, help them grow and develop. So we proactively innovate to extend our client reach, to make it more prominent and to help as many people as we can. We've developed and expanded the service by identifying need of the local healthcare and teams that we use and tailoring our service accordingly. Collaborative work, as I've said, we work a lot with our local hospitals. So we also have what we call our district direct service, which we help assist the hospital with patient discharge. Now, obviously, there's lots of barriers that prevent people returning home, and some of those can just be low-level measures as well as major adaptations. So we've developed a referral process for the teams to refer into us, so we can kind of get out there to help assist with that discharge. And we have an officer who works full-time in that role. We also help the hospital who have their own Handyperson service doing low-level measures. There's only one of those, I believe, and we help them as well. We support them during high demand or absence. So we work really well with our local hospital. So one of the innovations that we did with the service was our orthopedic medical procedure waiting list. So the hospital contacted us, and obviously because of COVID, which has caused no end of problems with operations, they asked us if there's anything we can do to help assist with their waiting list. So orthopedic patients are obviously classed as a high fall risk because of the nature of what they need: new hips, new knees, and the wait times for operations are obviously extensive, high risk of injury for the client. So they contacted us, and we were happy to help and assist with this, still within our West Norfolk boundaries. So we worked with the hospital. We came up with a data sharing agreement, which we both signed. This clinical commission group worked alongside us to help facilitate that. And how we delivered that is we provided an intro letter, which we sent to the client, advising that we were working in collaboration with the local hospital. We showed that we had their logos and everything on the letter, and just explained that because of the pandemic and because of the wait that they were incurring, we would be contacting them within a time period to see if there's anything that we can do at the council to help assist them whilst they wait for their operation. The first cohort was the over 70 cohorts, and we had patients from 70 to 93 on that cohort, and we sent out the letters. We called them back about a week later, and then spoke to them and asked who would be interested in taking out any low-level measures. It was very well received. They were very grateful to receive our call. Obviously, they were very keen to ask us, well, when will my operation be? Which obviously we couldn't answer. But we had 42 taking out the service, so 35%. And yes, it was very well received. I've got some feedback, which I'll show you later. And because of its success, we then did 2 more cohorts. Our next cohort was the over 60s. And then we had a much lower take up here. To send the letters and to call everyone did take time. So we tried something different, and because it was a slightly younger demographic, we tried putting links in for them to contact into the service if they were interested in taking out any low-level measures. And we did have a response to that, and we did end up calling some as well. And what we found is because of that cohort, the age range was between 60 and 70, and they, some of them were still working, some of them still had their spouses or partners, so they felt that they were assisted in areas where they might not be able to support themselves, so they were fine. And also, I think some associate the low-level measures with something that wasn't needed. They weren't old enough for that yet. So that was fine. We then did another over 70s cohort. We did the same process. So we sent out the letters and we asked them to call us if they were interested. And we had an 11% take up on that. So not quite as high as the first one, but we still had a good response. And we're going to look at reviewing that to see if calling them is more beneficial, you know, that personal touch and contacting people works better than getting people to call in. So what's come out of that is that it is well received. People on the waiting list for orthopedics are interested in having low-level measures put in their home whilst they wait. And so we're training in the future the orthopedic team at our local hospital to be able to refer straight away at the clinic. So rather than wait beyond that, once they're at the clinic and being seen by the physician, they can refer directly from there to get the process going and to get us out to help them. So that's really good. So that's been a really positive step. And next steps for us, really, we're looking in the future to develop that further. Is it something that we can offer to the stroke unit, for example? Is it something that can be offered to dementia patients? Just anything that we can help just to aid and assist people's living. So just to show you, it's just briefly just a visual just to show you how the cohorts worked out. So in general, the take up was 16% out of all three so far. So we feel that was well received. We should show some of the testimonials. So it was really, really well received. Some people were so pleased. Sometimes what our admin person is really, really good at is, I remember her having a phone call where she called a client and said, you know, is there anything that you need to help you, any grab rail? And she's like, oh, no, I'm fine, I manage. But actually she said, well, just walk me through your home and just tell me about anything you might struggle with. And what transpired was, well, she says, yeah, actually, when I go to hang my washing out, there is a big drop down to the step out of my back door, and I do struggle with that, and I have to try and hold on to the wall. And so we were able to put a grab rail in, and it was a simple thing. But as the top one says, you know, I didn't think I needed anything. You came out, and I'm absolutely delighted. So that was really, really positive. So outcomes. So really, it's just about client feeling supported by the low-level measures that we can provide, giving them their independence, reduce additional care needs, which is obviously benefit to the client and that person, even if it's a spouse or anyone. Peace of mind to extended family and friends. Major adaptation prevention, as I've said before, you know, sometimes people think they need something very big, and actually sometimes the low-level measures can just be enough that they're happy just to keep going with that. Not in every case, but in some cases that works really well. Reduced hospital admissions. Obviously, if people are being supported at home with low-level measures, they're not being admitted to hospital through falls, unnecessary falls. So that's really good. And obviously the signposting for clients to other organisations that they might not have necessarily had we not been able to help them. And just the collaborative working. I mean, it's worked really well. Our initial kind of service with District Direct has led us on to our orthopedic work with them, and we'll just keep on hopefully creating more initiatives that we can do, as well as working with social prescribing, health and social care and mental health organisations, which is obviously really important, especially after what we've all been through in the last couple of years. And that's it. Sorry, it's been quite fast. But hopefully if you have any questions that you need to ask about anything else on the service or how, you know, how we do it, please do email us in and we'll be happy to address those. Thank you.
Thank you, Sarah. I know you've got to run off, but thank you for this afternoon and congratulations on being Handyperson Service of the Year, or part of Handyperson Service of the Year. And if there's any question, we'll pass those on to you as well.
Brilliant. Thank you. Thank you so much.
Thank you, Sarah.